I think that the Breville would have been very beneficial to me and others in my community. It seems kind of uncanny that whether it's Portland in my neighborhood, or whether it's West Oakland or Richmond or Hunters Point, or wherever they're finding that the asthma numbers are exponentially higher than they are in other places. It's like, I don't know, it's because of our proximity to industrial contaminants or allergens, or what's triggering it. I don't know. Like I talked earlier about secondhand smoke. And I'm sure these chemicals in these smokestacks. You know, I grew up around in an unincorporated area in Portland, Oregon, where, or I can say unincorporated, but near the city outskirts. And it was a primarily African American community, and it was near a lot of industry, railroad tracks, meat packing, what they used to call slaughterhouses, that you could smell. At certain times of the day, you could just smell terrible putrid smell. The other kinds of industry that I don't even know what they are to this day, just factories. You see it in West Oakland, you see it in East Oakland, you see it in Richmond, you see it in Hunters Point, where the ground is contaminated now. You can't even do anything underground because it's so contaminated now. So of course, you're gonna get asthma, cancer, all these things. The Breville, as I understand it, is about information, and of course it's about treatment and all that, but I mean the education, the information is so important. If we knew, people always say, if I knew then what I know now, well, I mean, come on. If my parents could have been educated more on asthma, them being originally from the rural South, perhaps the information wasn't as widely spread even then in those days, because of course nobody knew that much about asthma then, but maybe even less, if you know, in their particular case. But to have allergy tests be mobile, to have information be mobile and come to you, to have treatment come to you. You mentioned about the emergency room. I went to the emergency room many times, all right, and they had to give me shots of adrenaline. And the shots of adrenaline, what it would do is it would make me, and I don't even understand to this day exactly how, but I used to get shots. I used to hate, I said, I gotta get a shot, I get a shot, and then that would help me cough up the phlegm, and then coughing up the phlegm would eventually let me breathe better. Then that attack would subside. Because you get so excited, and you get so nervous, and you think you're not going to have another breath left. You think it's going to be your last breath. You think you're going to die. You think you're going to die because you can't breathe. You literally like that. My mother had to sit up with me, and it would pain her like, oh my God, Lord, why? And it was hard. It was hard on her. You talk about asthma is hard on the family, the community, the educational system, etc. It is so hard on the family and your loved ones, especially your mother. You have a loving mother like I have. I mean, it pained her to know, and she had to sit up with me. So I lost sleep, she lost sleep. I mean, it was terrible. You're talking about missing school. I was a good student, so that didn't really hurt me. I was fine. I loved school, and I always made up my time and all that. But when I had to go to the hospital and get those shots, and the doctors, and I was a kid, I didn't know what they were talking about. And my parents, I don't know how much they knew what they were talking about. If the doctors could have come into the community, if there was a mobile facility that brought that information to us and took the time out and shared and really cared about our health, it could have been a world of difference. It could have made a world of difference. So I'm so happy that exists now. That's why I'm in support of it. I'm really, really passionately supportive about this Breville bill, because it's going to save lives. It's going to save lives. It's going to save spirits, because it's not just about life. It's about quality of life. And if you feel good about life and you feel good about your future and you think you're going to live, it's important. I mean, I have 2 children and they both had asthma. And I feel real bad about, perhaps, I didn't know whether asthma was a gene, or people say, well, you got this, so they're going to have this. And I don't even, to this day, I don't know the realities of that. But I still carry on a certain amount of guilt that I may have passed on asthma to my kids. Now they're grown now and they're healthy and they outgrew it. And actually, my daughter, who had it a little more severe than my son, she actually had 2 inhalers. One inhaler you take as a therapy and one was a rescue inhaler. And I remember Jackie Joyner Kersey, I believe, the great Olympic athlete, did a campaign about asthma awareness and treatment. And I think that's kind of like what helped my daughter learn more about asthma, and her mother learn more about asthma, and help her to be able to fight it. And her quality of life greatly improved because she had asthma very severely as a young child. It kind of reminded me of how I had it, maybe even more severe than I had it. My son had it, and he grew out of it a little sooner than she did. But it was that information, it was knowing more, treating it,